Prior to interviewing at the University of Florida, I had no connections or I had never been to Florida, but what really drew me to the program and what made me want to spend the next 4 years here was the welcoming nature of the program and the camaraderie between the residents that I felt at the interview dinner.
We believe the most important thing to creating great collaborative care, research, and education is you've got to have a really good culture. And the way that we build a really good culture is we work on it every day. And we have a singular, simple philosophy that guides our culture, and it works really well. The patient is the sun, and we revolve, we orbit around the patient. We're here to serve, we're here to impact people's lives. And so the idea for us is that if we always keep that in mind, we're always kind and we always make the patient the center, then we all know not just what we're doing, we know why we're doing it. And on the other side of things, this is what we expect. Now, the other thing that is so important to stress is that the people are the most important thing, but it's not such a bad thing if you have unbelievable facilities. And so we just lucked out many years ago. We were one of the first 3 places in the United States to get a brain institute. Now imagine this, we build a freestanding neuro hospital, and I call it like it's having rounds in that hospital is like Zen. All your patients are in the same place. And then on top of that, we've just built this Fixell Institute for neurological diseases that covers our full interdisciplinary mission. And so for the specialties that are interdisciplinary outpatient specialties like dementias and Alzheimer's and TBI and movement disorders and multiple sclerosis, we have great facilities.
What makes our program at UF Health and Neurology unique? Number one, I think, is the amount of flexibility that we have for our trainees. We really want to have an individualized experience for the trainees. If they want to do a purely clinical experience, they can. If they're interested in academic research, we have an R25 program where they would be able to spend some dedicated time as a PGY4 and then as a bridge grant into fellowship to be able to build their research portfolio. We also have an educational training program for those who envision themselves as an academic educator in the future, where they have the opportunity to really work closely with medical students, developing their own curriculum in terms of how to teach as a medical educator. And then we also have a leadership program.
The faculty that we work with in the Department of Neurology are some of the most experienced and world-renowned experts in their fields, and it's a real honor to train under them. I think that they've prepared me well as a graduating senior resident to go on and practice neurology independently in the future.
The reason you should come to University of Florida is we want to help to grow you so you can understand what you're passionate for. We can help you to make sure you spend as many minutes of your day, doing the things that you're super excited about, you're super passionate about. And as a chair, I want you to come here and I want you to have fun. And I have a fun rule. If you're not having fun, come to my office, because life is multiple choice. We can always switch and do something a little bit different. We want you to be as good as you can. So if you want to come to a place that has it all, but also has the humanity and also is going to be a fun way to spend 4 years, this is the place.